Shifting our focus now to Ebola. The Ebola infections are increasingly rapidly and outpacing containment efforts, and the World Health Organization has recorded 10 confirmed deaths as well as 220 suspected deaths since mid-May. The outbreak now includes more than 900 suspected cases. WHO chief has underlined how the epidemic in DR Congo is becoming extremely serious and difficult with every passing day. Now, as Ebola infections remain on the rise, the WHO chief is set to visit DR Congo to take stock of the situation. Several aid agencies have flown tons of relief into Bunia to help the hardest hit towns. However, responders face deep community mistrust. Locals have reportedly burned down 2 of the 3 treatment centers established in those towns, and funding shortfalls are making the response harder. In fact, in Bunia, teams of health workers in full protective gear are conducting dignified and safe burials to reduce transmission at funerals. An Ebola outbreak was declared in Congo's Ituri on the 15th of May, with Bunia among the main areas that have been affected. Apart from the DRC, confirmed cases of Ebola infections have been reported in Uganda as well. As infections spark an international health alert, Thailand has now imposed a 21-day quarantine order for people traveling from or having tested through DR Congo or Uganda, where a deadly Ebola crisis is surging. Thailand says the country has not reported any Ebola-affected travelers yet, and there is a risk from global population movement. That is why this arrangement has been done. In Uganda, 1 person has died, with a further 6 confirmed as infected. What about India? Well, India's aviation watchdog, the DGCA, has asked airlines to implement various measures as well. As part of the standard operating procedure, airlines having direct or indirect connectivity with Uganda and DR Congo are required to make mandatory filing and collection of self-declaration forms prior to deboarding of passengers. In-flight as well as arrival protocols for suspected cases have also been specified by the DGCA, including that in such instances the aircraft should be parked in a separate designated bay. Health authorities initially tested for the Zaire strain, but they later discovered the cause is a much rarer Bundibugyo strain, allowing the virus to spread undetected for weeks. DR Congo declared an Ebola outbreak on the 15th of May. This outbreak has been caused by the Bundibugyo strain of the virus, which has no approved vaccine or treatment yet.